Here at the clinic where we go, they're not accepting any more patients because community clinic in James Bay, because they don't have enough funding. Now, this question refers to availability of services. Do we have enough services here, like the Cubans that say, bring all your sick people here and we'll cure you, and no money involved in it. If you are sick, we'll cure you? Or are we short of? And we have to go to Cuba, like Michael Moore was taking people to Cuba to be healed.
He wasn't taking Canadians to Cuba. Yeah.
Yes, Canadian students are studying medicine in Cuba.
I understand, but but the patients he took to Cuba were Americans, right?
Yeah,
in that case,
yeah.
who are not getting proper assurance in the American system.
That's right. But here,
I think there's two things I'd say that I think are really important. And the first is, again, not on your list. So I'm going to bother your list here.
Well, you have to bring it in.
Absolutely.
There's a box at the bottom that says add your choice.
Here's what I'm going to say. There's something called the social determinants of health, right?
Okay.
People say to me, what would you do? What was the first thing you'd do? The first thing you'd do to address problems in our healthcare system. And I think the worst thing that's going on in BC right now with respect to healthcare is not a healthcare system issue. It's a growing inequality. So my argument is that the best way to address the issues of access to healthcare and public health are to address fundamental issues of inequality. And that may happen in the healthcare system, in other words, ensuring that everyone has access to a doctor, because that's not the case today. And if you move around a lot, it's more difficult to find a doctor, right? Okay. So if you have to move for work from Prince George to Vancouver to Victoria, right, then there's a challenge in finding a doctor. So there's lots of issues in the healthcare system, but fundamentally, the growing inequality in health outcomes in our province has a lot to do with income questions. And the growth of inequality.
So how about this? The question of availability of services. Did you say we do have enough services, but personal income is actually more relevant problem than whether we have or not?
I think what's required to address the inequality issue is to address these other questions that that we do have significant health services. We need to provide more, so I would agree that there needs to be more capacity in the system. Okay, we know there needs to be more capacity, so I agree with that.
So number one is not enough.
But I also think it's, again, for me anyway, if you're talking directly about healthcare, it is again a combination of one and two. We have to do both. We have to constantly optimize our existing facilities, because that's an efficient thing to do. We have to do that. We have to become more efficient. So when we buy an MRI machine, we better be using it to the maximum, or we're wasting our money, right? So we have to do that. But there are cases in communities that lack access, especially around the province and rural areas, who less and less have access to healthcare centers in their communities.
So would you agree with me if I put another topic here under healthcare services as determinants of health?
Yes,
then we can put poverty as one of them.
And I think we have to put forward those ideas and have that discussion, because, and the question might be, if you had extra money, what issue would you address? Would it first be hospital care, or would it be these issues of inequality?
Determinants of health is the next topic that we don't have it on the web right now.
We need determinants of health on there. I like your thinking.
And we're going to put your name under it.
I like it. I'm
Adrian
all for
Dix said that we should add this.
We should have a comprehensive anti-poverty plan.
And you'll be the first one to go and vote for it.
I'll be voting yes.
Okay, next question says, what does it include? What is healthcare constituted by?
Right.
Is it comprehensive? It's very prevalent here with at least three of them, or four of them. They say comprehensive. That includes medical, dental, optical, psychiatric, prevention education. And another person put in different words and say comprehensive service plus naturopathy. Naturopathy.
And then we got PSA screening at the bottom, eh?
And at the bottom, PSA,
PSA screening,
so people keep including things that others are not thinking of. But most of them, they say that healthcare should be comprehensive.
Yes.
The vast majority. What do you think about that?
And I think, and what people call comprehensive is different things, right? And this is always, there's always going to be a bit of a debate about this. I mean,
but the majority includes sight, Yep. And dental, which they're not included in the present healthcare system.
Yeah, I mean, sight is partially included and dental is partially included. It's a main difference between the Canadian healthcare system and some of the European ones. Is the issue of dental care.
I have to pay for my dental. I have healthcare and I have to pay for my teeth.
In other areas, we don't see long-term care here. Excuse me, but that could be part of it as well. So there's a tendency to say alternative medicines, and that's certainly the direction the NDP went in. So we saw more coverage under the NDP of traditional Chinese medicine, of physiotherapy, of other things that are now capped right now in the public system.
So if you were elected and you became the Minister of Health, you would include all these services that you're talking about?
Well, I try and move forward. I mean, I think you have to put forward a plan before the election so that people understand what you want to add in that 4 years and what you don't. Yeah. And so I mean, we'd want to go in that direction. But overnight, to add 100% comprehensive coverage of dental care.
You wouldn't do that.
Well, I wouldn't do it yet.
And why? Why? Because we don't have the money?
Because you'd have to. I think it's a more complicated process than that. You'd have to put it forward and say how you're going to pay for it. Absolutely. I think you have to provide both sides of the equation. You got to provide what you want to do and how you pay for it.
Well, tell me something, Adrian. When you say how are we going to pay for it, how do the French and the English and the Europeans pay for it?
They have a different system, right?
Which is pay more taxes.
Well, partly it's pay more. So they partly pay more taxes. First of all, the English system and the Canadian system. I mean, it depends what you're comparing. You could be going backwards because they've been going backwards in England for some time.
Yeah, we just have a couple of minutes.
I know. Just I filibustering you. I'm filibustering you here. What's going on?
So why don't you look at the?
So you see, I'm doing combinations all the time.
We look at the last question, which is drugs.
Yes.
Drug addiction management. And do you think that we have enough money there for treatment and for what do they call it, reduction, harm reduction?
No. Here's what we've done, and I agree with the safe injection sites, but a safe injection site without appropriate rehab services, which is what we have, right? What we have right now, they talk about pillars, but really the pillars we have is the enforcement side, which may or may not be adequate, right? And we have a safe injection site process, which allows people to stay alive. But without adequate rehabilitation services, and we clearly don't have those, right? We don't have adequate rehabilitation services. That's just a process for keeping people alive. And I think that we need to emphasize, and it will pay off for us economically to do this as well. We need to emphasize rehabilitation in a way that we haven't done to date. I don't favor, I'll say this bluntly, I don't favor the legalization of hard drugs like cocaine and heroin. I don't favor it. Okay. I think it's terrible for people's health. I think it's wrong for people's health.
Soft drugs.
And I think we should
marijuana.
We should advocate against that.
Before we go, just one last topic here, which says if you go back into the time on the return path on top, you go to provincial issues, and then you have healthcare subsidies. In other words, the budget, the total budget of healthcare. Do you think that it's enough or should be increased?
As a share of GDP, the healthcare system has been relatively stable in its costs. And I think we have to do everything we can to make the system run more efficiently, and we've got more work to do in that, especially as our population ages. But that we should view this as a share of GDP and ask ourselves...
Is it too high or too low as a share of GDP?
I think as a share of GDP, it's not bad. Okay. I mean, healthcare as a share of GDP will go up if, for example, we agree with the majority in the previous poll and it becomes more comprehensive.
Adrian, we're over time.
You're kidding, again.
Thank you for coming.
Thank you.